Hey there, I'm Joshua Johnson. It's good to be with you tonight from NBC News World Headquarters in New York. It is a busy Saturday night. We're watching hurricanes off our coasts, honoring the life of John Lewis, and bracing for more protests in America's streets. Let's start there. In Louisville, 3 people were accidentally shot ahead of a Black Lives Matter march. The injured are with a black militia group. The damage is reportedly not life-threatening. That group and a similarly armed far-right group are both part of the ongoing protests over the killing of Breonna Taylor. Contrast that with the scene in Selma, a city well acquainted with protests. A week of formal ceremonies began today, honoring a man who devoted his life to peaceful protest. Friends and family of the late Congressman John Lewis remembered him as a brother, a son, and a courageous civil rights leader in his hometown of Troy, Alabama. Another service took place in Selma, ahead of a moment bookending his remarkable life. Lewis will make one last trip across the Edmund Pettus Bridge, as he did 55 years ago when he was brutally beaten during a march for voting rights. Today's services required attendees to wear face masks. It's easy to see why. Coronavirus has infected more than 4.1 million Americans. In the last 2 weeks, we've recorded at least 50,000 new cases every day. More than 146,000 people are confirmed dead from COVID-19. Much of our economy remains on life support. The pandemic has left more than 30 million Americans unemployed. Perhaps you are among the folks getting $600 from the government to help make ends meet. That help is almost up, and there is no deal yet to provide more aid. Today, the Treasury Secretary and the White House Chief of Staff were both on Capitol Hill meeting with the Senate Majority Leader's staff. The House passed its plan months ago. The Senate hopes to release a deal by Monday. There is plenty for us to discuss tonight with our first panel. Andrew Desiderio is a congressional reporter for Politico, and Dr. Ebony Hilton is an anesthesiologist and critical care doctor. She's also associate professor at the University of Virginia. Good to have you both with us. And Andrew, let me start with you and this bill. Do we have any sense of what's going to be in it, aside from help for people who are struggling, hopefully? Do we know if there will be more money for things like testing and tracing and PPE supplies?
So Senate Republicans and the White House have been negotiating for about a week now on this package, and there have been a number of hangups. The main one has actually been over this issue of how to extend unemployment insurance, which of course expires this weekend, as you noted in your opening. Millions of Americans are receiving an extra $600 a week, in unemployment insurance, and that's scheduled to expire this weekend. And you know, they're trying to cobble together some sort of deal that would allow people to make 70% of their previous wages going forward, because there was a concern among Republicans in particular that a lot of people were making more money being on unemployment than they were at their actual jobs. That's concern number one. Number two, in terms of Senate Republicans and the White House, has been this issue of the payroll tax cut, which President Trump has been very high on, but there's just no appetite for it on Capitol Hill. And it doesn't look like it's going to be included in this next package, even the one that Republicans release. Instead, they're going to move more toward direct payments to Americans, similar to what they did in the CARES Act in March. So those are the two main provisions that they were sort of hung up over. Everything else, as you mentioned, money for schools, money for testing, contact tracing, all of that are going to be in this bill.
Dr. Hilton, today, Virginia reported a big increase in cases. A lot of them are in the Virginia Beach area. You're currently working in the ICU. What kinds of cases are you seeing right now? Young adults, seniors, a mix?
Right. And what we know across the board, not just in Virginia, is that the age of our patients that we're seeing in the ICUs are getting younger and younger than what we first reported. I think what America has to come to grips with is that when we're comparing ourselves to other nations and we're saying that older people in those nations were the ones getting sick, we have to realize that our nation in totality is on the sicker side of things. We rank as 34th in the world as far as the developed nations on our overall health. 34th as far as our life expectancy from birth. So we have higher rates of heart disease, we have higher rates of diabetes and obesity, and this is not with the elderly population, this is with the 20 to 60-year-old groups. And we're seeing those people get sick, and we're seeing them die, unfortunately.
Doctor, how are you and the other caregivers where you work holding up? How y'all doing?
Yeah, you know, here in Charlottesville, I will say in Virginia in totality, we are fortunate that we do have a governor who is a physician himself. And Therefore, there are certain things in place that were kind of more aggressively approached as far as closing down and a more strategic plan in how do we reopen our economy. Because you can see in some of the other southern states, Florida, South Carolina, Georgia, Arizona, in these other states, we're having a sharp increase in not only the cases, but also the deaths that are associated with it. So we're trying to hold steady where we are now. But what we know is that the cases will come, and especially when we start to open up these schools, particularly the college-age kids.
Andrew, regarding a deal, how likely does it look that there might be something to announce by Monday? Mitch McConnell's staff, the Senate Majority Leader, the staff is in town, but he, as I understand it, is not.
Exactly. Lawmakers are back in their home states this weekend, so it's very unusual for the Treasury Secretary and the White House Chief of Staff to be meeting just with congressional staff to work through what they say are just technical fixes in this bill that Republicans are going to release on Monday. Now, remember, that's just the starting point. This bill will have to be negotiated with Democrats, who, of course, released their plan and passed it through the House 2 months ago now, in the middle of May. So there are still many steps to go in this process. The Treasury Secretary told us last week on Capitol Hill that he hoped to get this whole process done, by the end of this coming week. That's looking increasingly unlikely, given mostly due to these differences between Republicans and the White House on the issues I mentioned before.
But it doesn't look like, I'm guessing, I mean, even if they get this done, well, correct me if I'm wrong, even if they get this done by the end of this week, the month technically ends on Friday. So for people who are used to having this funding continuously, should they just expect a hiccup in those funds if indeed they continue?
Well, there is going to be a lapse in the unemployment benefits. They really did expire this weekend for all intents and purposes, because the final checks had to be processed this weekend in order to go out next week. So no matter how you slice it, there will be a lapse in unemployment benefits. And that's, I think, the most urgent thing that both sides are trying to work on right now. They were floating a short-term fix whereby they would just extend those benefits for just 2 weeks. Obviously, Congress loves to punt. They love to kick the can down the road. But that plan was not supported by the White House when it was discussed on Thursday of this week. So it looks like there is going to be a lapse, and it's just a matter of time before Democrats and Republicans hopefully can come together on something in the next couple of weeks before the August recess.
Well, let's shift gears from the legislative to the judiciary. Dr. Hilton, last night, the Supreme Court ruled on the case of a Nevada church that wanted to hold services with more than 50 people. That's the limit in Nevada. The church argued that it should be treated the way casinos are treated in Nevada. Casinos, are allowed to have more people than that inside. Now, the majority on the court didn't even write an opinion. They just basically kind of told the church no. There were 2 dissenting opinions written. But, Doctor, what do you think of this decision, particularly because the dissents focused on the risk to the church's First Amendment rights?
Right. And I think in this time, we just have to realize that we've been focused on First Amendment rights and economy and whether or not we're going to be safe. But what this virus does not care about is the First Amendment right, nor our economy. I agree with the church in that I say that the casinos, they should also not be open and allowed to have that many people in one gathering. What we know is that across the board, for instance, in California, we have increases in our overall cases by 1,000% since reopening. In Florida, we're looking at 1,300% increases in the number of cases since reopening. South Carolina, the same thing, 1,000% increase. And so we're starting to see this uptick in cases, and what we know is that it lags about 2 weeks before we see an uptick in our deaths. And for the first time since June, we have now surpassed 1,000 people dying a day again. So we're going in this upslope. So I agree with the church in that no, the casino should also have this limit on how many people are allowed to go inside. But we're just not ready as a nation to fully open up in the ways that we are. We need to take that into consideration.
Dr. Ebony Hilton, Politico's Andrew Desiderio, glad to have you both to start us off. Thanks very much.
Thanks.
We have our first 2